am Dr.S.Vijayalakshmi, working as a professor in SNS College of Pharmacy. Now I am going to talk about the case study of ulcer. First, let us see what is peptic ulcer disease. Peptic ulcer disease is characterized by discontinuation in the inner lining of the gastrointestinal GI tract. Because of gastric acid secretion or pepsin, it extends into the muscularis propria layer of the gastric epithelium. It usually occurs in the stomach and proximal duodenum. It may involve the lower esophagus, distal duodenum or jejunum. So how is Helicobacter pylori diagnosed in peptic ulcer disease? Today, testing for Helicobacter pylori is recommended in all patients with peptic ulcer disease. Endoscopy may be required in some patients to confirm the diagnosis, especially in those patients with sinister symptoms. Today, most patients can be managed with a proton pump inhibitor (PPI) based triple drug therapy. What is the best treatment for ulcers in gastric remnant? The first choice for the treatment of ulcers in gastric remnant is drug therapy. In an open label trial comparing omeprazole, cimetidine, colloidal bismuth and misoprostol for ulcers in the gastric remnant. Omeprazole was the best in terms of cure rate and cure speed. How can peptic ulcer recurrence be prevented? To prevent peptic ulcer recurrence, the exclusion of these factors is necessary. Idiopathic peptic ulcers are thought to be one of unknown causes of peptic ulcers after successful H. pylori eradication. Therefore, long-term maintenance treatment with PPIs or hydrogen RAS is suggested when the cause of peptic ulcer recurrence is unclear. How long does a stomach ulcer take to heal? Gastric ulcers that are not complex can heal fully in up to 2 or 3 months. Duodenal ulcers heal in around 6 weeks. Without antibiotics, an ulcer might heal briefly. However, if the germs are not destroyed, it is normal for an ulcer to return or for another weed to grow nearby. What are the elements that elevate gastric ulcers? While eating specific meals that neutralize stomach acid or using an acid reducing prescription can frequently alleviate the discomfort it may recur. During meals and at night, the pain may be more severe. Many patients with peptic ulcers have no symptoms at all. Causes for gastric ulcers. Gastric ulcer causes such as Helicobacter pylori infection or overuse of non-steroidal anti-inflammatory drugs. Symptoms such as epigastric pain, heartburn, appetite reduction, weight loss and problems include gastric blockage, perforations and bleeding. Complications may require surgery. Gastric ulcer causes of patients over 65 with frightening symptoms should be directly for endoscopy, while those under 65 should receive treatment for Helicobacter pylori. Now, let us see a case report. Male person, 23 years old. He was diagnosed for gastric ulcer. Gastric ulcer symptoms are nausea or vomiting, feeling of bloating, quickly feeling full, heartburn, dull pain in the stomach, weight loss and anemia. Specialty is gastroenterology. Background: ulcers of the stomach are painful lesions on the stomach lining. Gastric ulcers are ulcers that infect the stomach as well as the small intestine. Ulcers develop in the stomach with the reduction of mucus causes the digestive acids to eat away the stomach's lining tissues, resulting in an ulcer. A case review: a 23-year-old guy went to the clinic with complaints of upper stomach discomfort, heartburn, nausea, occasional vomiting. After eating a heavy meal, the gastric ulcer pain becomes worse at night. He has a background of gastric ulcer illness running in his family. He don't have a habit of cigarette smoking. Coming to the case discussion, James was using medicines to relieve pain from the past 2 days but with no significant effect as per the information provided by the patient. The gastroenterologist performed laboratory tests. The test showed no signs of bleeding and blood was absent in stool and vomiting. The serological and urea breath test confirmed Helicobacter pylori positive infection in the patient. Treatment for the disease. A patient with a gastric ulcer can manage the symptoms by taking medicines as prescribed. The gastric ulcer treatment includes administering antibiotic therapy. James should avoid spicy foods and late night meals at all costs. As a result of bad eating habits and a sedentary lifestyle, the patient has trouble altering his daily routine. James should follow a proper gastric ulcer diet, including many leafy vegetables, cabbage, broccoli, cauliflower, radishes, probiotic-rich foods such as yogurt, miso, etc. He should stay away from sour and spicy foods. Routine checkups and proper treatment in gastric ulcer causes can cure stomach ulcer. Thank you.